Thank you, Mr. Chairman. If you could you put that up for me? Ms. Hyde, do you recognize what this is here?
Yes, it's a, yes.
It's a screenshot from SAMHSA, this website. I believe it's called Building Blocks for a Healthy Future. Is that correct?
That's correct.
Can you briefly tell me what that website does?
It engages young people and their parents in emotional health development. We do have a responsibility to do prevention
What's
in
the
early young
ages
people.
for that?
I don't remember off the top of my head the complete age range, but it's the younger.
It's for
younger
substance
kids.
abuse for young children from the ages of
Yep.
3 to 6.
Yes.
Which I'm sure that's a high number that we have to deal with. I mean, I have 5 kids from 10 years old to 4 years old, and I'm sure there's a high rate of substance abuse with 3-year-olds. Yet, do you know how much money we've spent on that website?
Actually, the science tells us that the earlier we start, the better.
Do you know how much money we spent?
I don't know that off the top of my head. I can tell
Ma'am,
you, though, and
you're
it's
the
important that we are.
Ma'am, you're the administrator.
Yes.
And you don't know how much that website costs, because I went through that last night, and there's a whole bunch of songs on there, which are all knockoffs of Old MacDonald and Yankee Doodle. And I've got a 3-year-old, and I couldn't keep her attention for no time at all on that. And guess what? You've had 15,000 visitors, that's it, to that website for an average of 3 minutes at a cost of $436,000. Now, do you think that's using taxpayer money wisely?
Actually, we're going through
No, ma'am, that isn't what I asked you. I said, do you think that is a good use of taxpayer money?
I don't know. Please let me finish the question. I'll tell you, we're actually going through our website right now. This is one of them. It's on the list to re-examine.
Going through, ma'am,
whether
the money's already spent. Was it a good use of taxpayers' money? $436,000. A total of 15,000 visitors. In Oklahoma alone, that would provide 176 outpatient services for the mental ill for a full year.
That's what we're assessing and evaluating right now. We're going through each of those websites to determine whether or not they are appropriate or need to be continued or eliminated or otherwise dealt with.
How long does it take, ma'am? Because we're continually putting money in there. We're managing the website. And what we want to do is efficient and be more efficient. We've heard throughout this entire hearing that we're here to help. We understand there's an issue. But what's happening is we're running into a roadblock. And instead of you admitting that there's a problem, what ends up happening is you get defensive about it. That's not helpful. That doesn't prevent anything. All that does is cause a division between us. We're not here to make you look bad. We're here to find out and see if you're being efficient with the money being spent. And so far what I'm finding out is no, it's not. It's not being efficient. I have a big stake in this. I've got 5 kids that go to school every single day. These are real issues facing every parent out there. And yet we're wasting money on a website. We're putting money out here, $436,000. You don't even know how much is spent, and you can't even tell me if it's being efficient. Instead, you're saying you're going through it and evaluate. We've heard that over and over again today. We're going through it. We're going through it. We're going through it. You know, as a business owner, if everything I was being evaluated on, I was having to go back and reevaluate it, I would deem that as a failure. Maybe it's time to relook at the whole program. Say, is it really delivering the services? Is it really coordinating with officials on the mentally ill? So far, what I've heard, the answer to that is no, absolutely not. Dr. Cohn, you had mentioned, let me find it here. You noted that part of the problem with tackling serious mental illness is the steering and coordinating committees that have been established to handle the response to the mental illness over the past decade are no longer active or focus mainly on substance abuse. Is that correct?
That's correct.
Okay. I yield back. Thank you.